Hello and welcome again to the sterile processing certification course. We are going over chapter 11, which is complex surgical instrumentations. My name is Corey Drinkett and I'm the instructor for this class. Complex surgical instrumentations. Last chapter in chapter 10, Rachel went over some of your basic surgical instrumentations. We're going to go a little bit beyond that. This is more of instrumentations. This is where these instruments are harder to clean. They've evolved. This is stuff that is for your minimally invasive procedures. This is stuff that is used on total hips, total knees, stuff like that. Complex instruments are those that have multiple moving parts, channels, or attachments. Because of their design, they require special handling and cleaning protocols to ensure patient safety. So complex instruments, they come in. Some of them come with removable parts to where you have to disassemble them just to get them clean. Some of them don't even come apart, so that makes it a challenge for them to be clean. Some of them require more soak time than others. Some can go into the washer, some cannot. Some can be submerged in the water, some cannot. So this makes this whole some of these instruments very difficult to clean. We will cover three primary power sources used for the surgical instruments. There is electric, pneumatic, and battery powered. Electric systems are preferred when lightweight instruments are needed, especially in areas with limited access. They require a sterilizable cable and must be protected from fluid invasion during the cleaning process. Your pneumatic tools. This uses either compressed air or compressed gas and are suitable for a wide range of the bones. Just like the electric systems, they require a sterilizable hose and must be cleaned carefully to prevent fluid from entering the hose. Battery power tools often offer the advantage of being cordless, so there's no cords involved, making them ideal for procedures on large, dense bones. It's important to note that their batteries and chargers are not interchangeable with different models. The guidelines. Just remember with these hoses and with these the hand pieces, the attachments itself is fine, but mainly with the hoses and the hand pieces, most of the time you cannot submerge these at all. We do not want water or the water solution to get into these components. If water gets in there, they're not going to work right, which means we have to send them out for repair, which means it costs the department money. We do not use anything that is not required for us to use it according to the manufacturer IFU. Some hand pieces and some components with them need to have lubrication. Some do not. So we have to follow that IFU. Make sure if it's a lumen that we put the brush all the way through it. Make sure the brush fits perfectly so it can get all the sides and go all the way through. And we have to dry the equipment properly too. We don't want it soaking wet when it comes out of the from the decontamination into the assembly area. We don't want it dripping wet. A little bit wet is fine because we can dry it the rest of the way on the clean side, but we don't want it dripping wet. So please dry it as much as possible as you can on the decon side. Complex instruments. This is some of the examples are. We will talk about rigid and flexible endoscopes. There is a difference. We will talk about your laparoscopic instruments. These are instruments that are mainly used for abdominal procedures. Your robotic instruments. This is just a more advanced version of a laparoscopic instrument. And we will talk about orthopedic power tools. Endoscopes. They are categorized as either rigid or flexible. Flexible endoscopes are especially challenging due to their internal channels. Plus, they also have a leak test that is crucial before the cleaning process. So within endoscopes, they come in different sizes, different lengths. They're dependent on what they are used for. There's some that's for the ankle and for the wrist. There's some for the shoulder and the knee. There's some for the abdominal area. So it just depends on the length. So the rigid ones are they don't bend. So please do not try to bend these. There is some like the urethroskopes that are a rigid scope, but they are just a little bit more flexible. They don't bend a lot, but they do have a little bit of flexibility to them. But just remember, with any rigid endoscope, you don't bend them. They will break. Flexible. It will look like the picture on the bottom of your page here. That is a flexible endoscope. Some of your flexible endoscopes have channels to where they can put instrumentation down through it and do a procedure with it. Either get a biopsy or whatever they have to do. Some of them can be flushed with water and air or suck. So it depends on what type of scope they are using. Your laparoscopic instruments. These can trap bioburden in their lumens and hinge parts. So thorough cleaning is essential. Follow the IFU for disassembly and cleaning. This is a picture of some of your laparoscopic instrumentation. They are longer. They do come in different lengths, but they also do come in different widths too. Most of these looks like are a 10 millimeter type. Some of them are a 5 millimeter. Some of your laparoscopic instruments, they do come apart. There's some that come apart into 2 to 3 parts. Some of them do not. Some of them have a port, which means you can flush that port through and try to get stuff to come out at the distal end. So it just depends on what type of laparoscopic instrument that we are looking at. Your robotic instruments. These have delicate moving parts and these are very expensive. They cannot be processed in standard ultrasonic machines, so you must refer to the IFU. Robotics is still a new form. A lot of hospitals do have robotic instrumentation. They kind of do look like just your regular laparoscopic instrumentation, but the head of it's heavier. There's more moving parts to it. These do not come apart at all. At the at the base of it, the head of it, the white portion of it, or the blue, whichever one we have, there is ports. There's a 1 and there's a 2. You will flush those ports with water, with the solution, with rinse water. These do have a soak time. They have to be soaked after the operation, and when they come down to us, they have to soak for 30 minutes in a water solution, and flushed at the same time. After you clean them and you flush them and all that, they can go in an ultrasonic, but it has to be an irrigating ultrasonic. So there's got to be a hose that hooks up to it, to where when it's running, it's flushing water through that port. Now, according to some of the IFUs, depending on the maker of these, after the ultrasonic and after you rinse them and all that, and dry them off, they can just be passed through the window into the clean side. Me personally, I'm going to send them through the washer disinfector. We do have a rack, especially for robotic instruments. You hook it up to the port, so as it's washing, it's flushing, it's putting chemicals and water and rinse water and all that through that port to clean it. So I go a step further, and I do put it through the washer disinfector, just as a special precaution on my part. Power tools. These are mainly used, a lot of these, it depends on the type of tool. Most of them are used in orthopedic procedures, but there is some that's used in the ear, used on the hand, on the foot. Just so it depends on the type of orthopedic what type of procedure we're using this for. So they must be clean and dry thoroughly to prevent corrosion. Just remember the handpiece. In this picture here, the handpiece is the big tall thing. That's the handpiece. Everything else is an attachment. The attachments can be submerged. That's fine. The handpiece, therefore, cannot. So just be careful of that. That will be just wiped down and rinsed off. Make sure remember in chapter 7 where we discussed the point of use, the decontamination. The OR must do their part to help us out. So proper cleaning begins at the point of use and includes both manual and mechanical methods. Use only validated cleaning agents and techniques. So when you're using these, making sure we use the appropriate detergents. Orthopedic, these drills do not need to go through, some of them can go through the washer disinfector. If you do, they do not use the lubricated cycle. Make sure it's on an orthopedic cycle that does not have a lubrication cycle with it. Visual and functional inspections help prevent surgical complaints. Always inspect under proper lighting and magnification. In decon, that's we don't really have a lot of magnification devices in decon. Hopefully we have enough lighting that we can see a lot of this. Just make sure you are brushing it or wiping it down real good. If it's a lumen, make sure you're using that brush. Make sure you are flushing it. Making sure you do the right thing at all times. Preventive maintenance. This will extend the life of the instrument and ensure safety. Keep accurate records and follow established checklists. With preventive maintenance, if we have a device that is broken, we send it out for repair. The repair people will let us know if they can repair it, they will. If they cannot, they will let us know and we will get it reordered. But preventive maintenance, this helps keep our instruments working in good working condition, so that they don't break down. We do keep records on the preventive maintenance portion of it. Just to recap, complex instruments demand specialized knowledge and care to ensure they are safe and effective for reuse. Proper processing protects patients and supports the surgical success. So just remember, complex instruments, we just have to take more time with them. Sometimes it takes a longer soak time, which is fine. While they're soaking, we can still do some other instrumentation. We just have to remember too, we cannot have fluids getting into those handpieces and those cords. If they do, it starts breaking that instrument down, which means we have to send it out for repair, which costs us more money. These instrumentations are expensive. They really are. So we need to make sure we protect them as much as possible. You should be able to identify complex surgical instruments, understand their components, and to describe the correct process for cleaning, inspecting, and maintaining them. So go over these. Make sure you can answer some of these questions. Can you discuss the procedures to care for powered surgical instruments? What are the procedures that we use? Explain the critical protocols for processing endoscopic instruments. Remember, there is different protocols that we use. Discuss the rigid and flexible endoscopes and their accessories. Rigid endoscopes, they don't bend. Flexibles do. Flexibles has more accessories than the rigids do. And like I said, these do not have any right or wrong answers. This is what you are getting out of the information. For your workbook exercise, the practice exercises are on page 44 and 45. Your review quiz is on page 46. For your review quizzes, if you want to send in a picture of your quiz, that's fine, but I really would like to know how many you got right. And again, my name is Corey Drinkett. My phone number is listed. You can text me or call me. I advise you that if you text me, please put down your name first, because if you don't, I'm not going to respond. And then I will add you to my phone, so that the next time you text or call, I know who I'm talking to. This is my email address. It's Corey.Drinkett. It should be all lowercase. I made the mistake there. But it's Corey.Drinkett@FranciscanAlliance.org. Email me if you have any questions, please. And I thank you for your time in reviewing chapter 5 with me. And have a good night. Thank you. Bye.